Hi, guys. Welcome to Real Food Recovery. We are here today with a special guest, and we love to have guests on. But before I say do anything else, I must say hello to Jamie. How is it going, girl?
Hi, happy to be here. Happy to be here and excited for our guest today. We are, we love interviewing guests typically on Real Food Recovery, and today is no different. We have today joining us Dr. Barb Woegerer, who's a licensed naturopathic doctor, practices in Toronto, Ontario, Canada. Dr. Barb is passionate about empowering individuals to take control of their own health. Her primary focus is to explore the underlying root cause and provide individualized, patient-centered care. She utilizes evidence-based therapies and provides patients with the knowledge and tools needed um, to succeed. Her clinical focus is in women's health, metabolic health, and inflammatory conditions. Dr. Barb spends a great deal of time educating individuals on the importance of magnesium and why we all need to add this mineral to our health toolbox. When she's not seeing patients, she loves spending time in nature, reading and experimenting with new recipes in her kitchen. You can find Dr. Barb on Instagram at Dr. Barb Woegerer, where she'll share a wealth of information on magnesium and inflammation. And alternatively, you can also contact her through her website at www.barbwoegerer.com. And we'll link all of this in the show notes so you don't have to look for it or try to find it on your own. So welcome, Dr. Barb.
Thank you so much for having me. I'm really excited to be here and to have a wonderful discussion about a mineral that's very important. And I hope the rest of your audience will think it's important after this as well.
Yes,
Sure. Do you want to
I
just
definitely do.
yeah. Do you want to get into why you think it is so important? Especially, I'm wondering if you think it's more important for women than men and just basically how it affects our overall well-being. So sell us on that. And I'd be curious what brought you to this point to it. Something had to make you steer the ship towards magnesium. So you want to talk about that?
Yeah, I'll start with that. So I'm a naturopathic doctor, and in Ontario, Canada, we are behind primary care physicians that are medical doctors as far as medicine. We are part of the primary care system, but most people would attend a medical doctor, and if they are having issues or they want to, co-manage patients, they would come see us. So most of my patients that come to me already have seen specialists, have seen doctors, have seen a lot of things. And so a lot of the times they come to us as a last resort. And so we get really tough cases. And when I first started out, I was like, I would do all this research on these, and I couldn't just use the regular treatments because they were already used and they hadn't worked. And I kept coming upon magnesium, magnesium, magnesium. And I was like, wow, what is this? And we just learned it was a mineral and electrolyte, like in school. We didn't spend any time on it whatsoever. And, I would send these patients home with a dose of a certain form of magnesium, and they would send me a message back in a week and they would be like, oh my goodness, I'm like feeling X much better, or
Wow.
this has resolved, or this is a lot, more dealable, like as far as pain or anything like that was concerned. So that just kind of got me kind of thinking, and I kept making notes on all the stuff I came across. And eventually I was like, okay, I just need to spend some time in the research and really get to know this mineral because it just kept coming up so often. And
Hmm.
started this whole progress into literally going through, 120,000 review studies and published studies and clinical trials and all of the things. So there's lots of research behind this mineral, and a lot of it we really don't talk about. We really know magnesium as something for stress and something for sleep, possibly, but it does so much more than that. And so I just really wanted to kind of articulate that and create awareness around this mineral and how important it is for men and women. I mean,
Okay.
we are going to obviously have a lot more issues because of the way that our hormones are. And so we're going to be looking at probably more so women, but it totally benefits men as well in many different
Yes.
um,
Yes. I'd love to talk more about that,
yeah.
because that's something I don't think a lot of men even think to ask about.
Yeah, and I mean, like it can be a lot of different things, right? Like it's
Yes.
brain health and it's
Yes.
hormone health like testosterone, and it has blood sugar regulation. Like these are all things that are common in men and women. This is not
Yes.
just for women. I mean, I
Yes.
think where we're really concerned with women is bone health, especially after menopause.
Sure.
Uh, cardiovascular health, especially after menopause, mood and cognitive function, especially after menopause and prior to menopause. So
Mhm.
there are more that are directed in a certain pathway, but overall, I would say that this mineral benefits everyone, children included.
Yeah. Beautiful.
Oh, yeah, I
One of
never, yeah, go ahead.
one of the area, well, again, it's really blowing my mind to hear it. One of the areas that I think that is most interesting, is like that it's this sort, it sounds like the way you're describing it, and it's sort of a building block nutrient in a way, or a mineral in a way. And but it's sort of a component that helps other processes, minerals, vitamins work in the body. Is that what I'm hearing?
Yeah, yeah. So magnesium it's obviously a mineral, but it's a cofactor for like 800, what we call enzymatic reactions. So if we just dumb that down, it basically is required to do a lot of these transactions that happen in the body. It requires magnesium. So and it started like when you look at the earlier studies from even 10 years ago, they had that number at 300. So as of December 2023, that number is at 800. So they are
Wow.
starting to pull more and more out where they can see that magnesium is a necessary factor in an enzymatic reaction. So some form of biochemical reaction that is happening in the body that needs to happen in order for something else to happen.
Hmm.
So
Yes.
this is why it's so crucial. And unfortunately, a lot of these symptoms of low magnesium mimic other health conditions. And so those other health conditions are
Wow.
been sought after right away. And we don't even look at the fact that is their magnesium status even like remotely decent?
So how
Wow.
would you know which
Yeah.
is which, if it's a magnesium problem or something else?
Usually, well, this is the other thing. Magnesium is really hard to measure in a non-invasive way. Uh,
Hmm.
so what's important to remember or what to know about magnesium is that 60% of it is in the bones and tissues. Only
Okay.
1% of magnesium is in the blood. One. So if you're taking a serum blood of magnesium, we are only looking at 1%. So it's not a reliable factor.
Reliable test.
No, the reason they test it on your blood work is because it's an electrolyte and your body tightly regulates that. So I would say 95% of people who don't have an electrolyte dysfunction are going to be within that range. And so a next best test would probably be like a red blood cell magnesium test. And it's a little bit more accurate, a little bit more sensitive, but it's still not perfect. You would need to take a tissue test or
Oh,
which gets a lot more invasive than just blood work. And most
Okay.
people are not going to do that. So we also have to look at that individual and how much of their lifestyle or health or medical history is actually depleting magnesium, and then how much do they actually need as whatever's going on in their health, right? So if
Okay.
you have bone health that's like you got to look at kind of what we're trying to do and how much is actually leaving their body because magnesium actually is depleted in so many instances.
oh. Well,
Wow.
besides the testing, are there just signs and symptoms to look for?
Yes. So a lot of, like I said, they're going to be a very broad amount of symptoms, but like, stress, like they can't actually deal with their stress very well. They're not resilient to the stress. They might have blood sugar issues, right? They could have
Mm.
insulin resistance. They could not be sleeping. They might have tremors, they might have heart palpitations, they might be really anxious. But see, as you can see, these things all belong to other health conditions. And so
Right.
oftentimes we immediately go to that health condition and we try to look at it from that perspective. And I
Yeah.
think sometimes we have to look at and go, okay, they are on XYZ medication. They have this much stress in their life. They
Mhm.
don't eat a good diet. They're maybe on a standard American diet. So they're losing a lot of magnesium. They're not getting a lot from their foods. They're not supplementing. Could this actually be a magnesium problem?
So one of the things that I was taking a picture of some of the doctor's orders that I got when I was going through some things last year or earlier this year, I guess, but really the end of last year. And they put me on some specific magnesium, and there's so many different kinds of magnesium, right? There's like at least 3 or 4 that I've heard of, and maybe I'm sure you know of others, but you know, my question is what magnesium are we supposed to take for what?
Right. Yeah, that's the big, yeah, good
Because
question.
I'm looking at these orders, like I'm blowing them up and looking at the order, the way that they wrote them, and it's very confusing what you take for what.
There's a
Yes.
multitude of different
Mhm.
kinds of magnesium.
Absolutely. And that is probably one of the most common questions I get. So common that I actually released a book in May about the magnesium, the different forms of magnesium.
Hmm.
Because it is such an asked topic and it really matters. It matters what form you take as to the outcome that you are looking for or the outcome that you are hoping to get. And so, yes, there are a lot of forms of magnesium. Some are great, some are not so great, and some we should probably just stay away from. Um, to start with, kind of like the more common ones, bisglycinate is going to be a really common one because it's a kind of an all-around form of magnesium. So it's kind of a general use magnesium, and it will be really great for stress and sleep and muscle pains and those kinds of things. It's just going to touch on everything. And then we have something called malate, which will follow up the bisglycinate. And malate is more for people who have chronic fatigue syndrome or fibromyalgia, or they have like these points that are very tender, or a lot of joint and aches and muscle tension and those kinds of things. And it also is very energy driven. So again, for people who have a lot of less energy or fatigue, we like to look at malate. Then there's citrate. Now, citrate is more
Yes.
digestive function, right? So we're looking at it more for constipation, reflux. We can use it for sleep. However, it does have a little bit of a laxative effect. So we can't usually dose very high with citrate, but it does a really good job at dealing with, constipation and digestive issues per se. Um,
Okay.
Did you say sleep on that one too?
yeah, it can
Right.
be for sleep, but you have to be careful with the amount that you're going to use. So
Sure.
citrate can cause a little bit of a laxative effect. Um, so if you have nothing else and you want to take it for like constipation, you would be taking it at night. So it could act as like a sleep agent as well.
Oh,
Yeah,
that's a good
Okay.
yeah.
Now,
idea.
what about glycinate, not bisglycinate, just
It's the
glycinate?
exact same thing. So bisglycinate and glycinate are exactly the same. It's just some
Oh,
companies will add the bis in front, which just means 2 glycine, right? So glycinate
right.
is 2 glycine molecules and a magnesium molecule that's put together. And so all the forms of magnesium are put together with another molecule in order to get that magnesium into the cell. It needs like a little bit of a transporter. And
Sure.
so bisglycinate and glycinate are exactly the same. They don't have any differences. It's just the wording is different
And
on
what magnesium is good for sleep?
bisglycinate or glycinate. Yeah,
Oh,
that,
really? Okay.
yeah,
Now,
yeah.
I've never heard of malonate. I've only been told to take glycinate, which is the one I was zooming in on a few minutes ago to see what they had written. It was glycinate or bisglycinate, I guess. I've had not prescriptions, but supplements that had both in them. And yes, it did definitely helped with stress, muscle, but I had all kinds of joint issues and all things, and nobody talked to me about malonate.
Yeah, so malate is very much if that's kind of like the main concern for the individual, I would always choose malate over glycinate just because
Okay.
malate is
Okay.
really structured to do that. So it's a lot of tension, like I said, or tender points like we see in fibromyalgia, where
Sure.
just anything in the body is kind of like achy and tender and tight and those kinds of things.
Or
Uh,
lipedema also can have a lot of leg pain and other pressure points.
Yeah, yeah. So that's where you would use malate, or on the other side of that would be fatigue, like I'd mentioned. Uh,
Yes, low energy. Yep.
yeah, yeah. And then there's L-threonate, which is a fairly new magnesium on the block.
Hmm.
It's a little more expensive. That's one thing you have to know. It's
Mhm.
also dosed much smaller, and it's really it's a unique one because it travels across the blood-brain barrier. So it's very much indicated for cognitive stuff. So brain health.
Mm.
This could be memory, this could be cognitive function, it could be comprehension, it could be just cognitive decline. It helps with that. There's actually a pretty good recent study that showed they used it for 12 weeks with cognitive decline patients, and they
Mhm.
actually were able to regain 9 years of brain function. So it works really well. It's just it is a little bit pricier than the rest of the magnesium that you would find. So there's
Can,
the L3.
can I stop you and ask a
Yeah,
question on that? I mean, I can see I have menopause brain and things just are not crisp like they used to be. Would that also affect someone like
brain
me?
fog. Yeah,
Yeah.
yeah.
Yes.
Yeah, absolutely. Anything to do with the brain, L-threonate is going to be very helpful. So we even use it for anxiety, depression, mood disorders, those kinds of things. So really anything that you can kind of conceptualize as brain, you would kind of use
Yes.
that form of magnesium. And then there's a couple that are a little harder to find. Orotate is one of them. It's very much specific for cardiovascular health. So blood pressure, people who have had heart attacks, people who have heart failure. And it's dosed, you need to work with a practitioner on that because it's dosed up dependent upon what the actual issue is, but it's very much structured for cardiovascular health, has a ton of research behind it. We just don't hear about it very much. So yeah,
Okay.
yeah.
Interesting.
So helpful.
Yes, yes. Now you're going to come across one that's called oxide. And so you'll see this in pharmacies usually, or sometimes in health food stores. And so oxide is not something we want to actually have in our supplements unless it's
Okay.
being used as a buffer. And that buffer is then told, like we're told how much is actually used as a buffer, because it's very cheap. It's a small molecule, so they can use a lot of it in an
Okay.
actual capsule, but we only absorb 4% of it. So you're not going to get much from it. It works really well if you need to have bowel movements and you're really constipated, a laxative effect. It works
Yes.
fabulous. And I have used it to help with clear outs for bowels in patients that are very backed up or that have retained stool. So it works in that capacity, but it should not be a part of a regular supplement because we don't absorb it at all.
I think that
Okay.
might be the kind I take that my husband like picked it up at the grocery store. Like Nature's brand or is that pretty typical for something like a grocery store brand would carry?
It can, but oftentimes you'll see in those types of brands, it's mixed. So it'll be like oxide, citrate, and something else.
Mm.
It can be like two or three different types of magnesium. The problem with that is as well is they will not disclose how much. So it might say, let's say oxide,
Oh,
malate, and then it'll say 250 milligrams. And then you call them and you say, okay, well, out of that 250 milligrams, how much of is oxide? And they will say, sorry, that's a proprietary blend and we can't tell you that.
yes.
And then my concern is, okay, is 200 milligrams of that 250 milligrams actually oxide? And is 50 milligrams coming from the other two, which you're not going to see benefit from something like
Hmm.
that.
Okay.
Problem with the multi forms of magnesium in a formula. So, yeah.
When I first started going through menopause, I mean, my sleep just overnight, it's like somebody's flipped a switch and all of a sudden I'd been a fine sleeper all my life and I literally couldn't sleep at all. Same with bowel movements. All of a sudden that stopped functioning. And I remember one of my girlfriends saying, try mag glycinate and black cohosh. And actually, because I hadn't been on hormones yet, I thought that mag glycinate really did do a good job. And then I got on hormones, so I got away from that. And then I don't know why I thought, maybe it was I was having some sleep issues again. And I just remember my husband brought something home from the grocery store. But, and I think it is just that cheaper, it would be the cheap oxide is the cheapest, right?
Yeah,
Yeah,
it's
I
very,
think it's just in the pharmacy section at the grocery store. So, but I know I've tried that citrate before, and I have had like wicked bad dreams when I take that. Is that my imagination?
no. You can actually get that with bisglycinate as well. So people are sensitive. And remember, I had mentioned that there's always a molecule that's attached to the magnesium. So in
Hmm.
bisglycinate, it would be the glycine. In citric or citrate, it's citric acid. And so sometimes these components, you might be sensitive to. And so when you're going to get a citrate, a magnesium citrate, you're getting kind of a large dose of both the magnesium and the citrate, and this can cause like a sensitivity. So in those cases, we start really slow. Like we will go to 1/3 of the original dose, and then
Ew.
yeah. So
So
you'll
that's the workaround.
yeah,
Interesting.
yeah. And you'll also see with some people, they'll get more anxious, right? So magnesium helps with anxiety, but if you kind of dump in a lot of magnesium all at once and the body's
Hmm.
not used to it, you're going to trigger more anxiety. So you need to work slow with those individuals and work their way up until their body actually gets used to the dose.
Interesting.
Very helpful.
Sorry, Jamie, can I ask one more thing and then
Oh, of course.
um would you say that sleep and bowel movements are the main two things that people are looking to magnesium to resolve?
I would say most people, they're not even using it for bowel movements. Most people are using it for sleep or stress. Like this is where magnesium has all of its kind of knowledge publicly. It's like if you have stress or you have trouble sleeping, take magnesium. This is kind of what everybody knows. Or if you stop people on the street, this is the two things that they would likely say to you.
Hmm.
They don't even think of it for bowel movements, really.
Hmm.
Mm.
Yeah.
Now, do you have any, and the book, right, came out, but do you have any brands of supplements that you really like to
Yeah,
stay with, or forms of supplements, right? Liquid
yeah.
versus oral versus sublingual or injection, where do you start? Like I know I'm a big fan of Thorne supplements. I have been for a long time, but I'm very particular about I only buy them from Thorne. Right.
Yeah.
So there's all kinds of, I think from what I've learned, like all kinds of wonky supply chain things that can happen or are intentionally done to make supply chains look as if they're manufactured, but they're not.
Right. Yeah, I usually always say to patients, so first we want to figure out dose, then we want to figure out form, and then we want to figure out that we got a good product, right? Like
Got it.
if we have a break in any one of those kind of three areas, then we're probably not going to get outcomes that we want. Um,
Mm,
so yeah, so a lot of brands I deal with, I'm in Ontario, Canada, obviously, but they're more like Designs for Health, Thorne is
sure.
one of them. Cytomatrix,
Mhm.
NFH, like these are all more professional brands that are third-party tested and they do a lot of testing, in research studies and stuff like that. So I tend to go towards those types. As far as whether you want to do, there's many forms that of types of magnesium, like you could do liquid, you could do powder, you could do capsules, or you could do gummies, right? This is kind of what's available right now on the market to take. I always prefer capsule over any of the other ones, only because the more processing we have to do, the more you're taking away from the action.
Exactly.
Yeah. So,
That makes sense.
a gummy has a lot of processing. It's got to be soft and chewy and taste good and all the other things. So you've got a lot of other ingredients coming in with your magnesium and your
Can
glycinate,
we
lysine.
Can we as adults stop with the gummies? Like, I mean, honest, can we stop? Because, at like 8 or 9, I was taught how to swallow a pill,
Yeah.
and now they make them in all of these ways that they're easy
Yeah.
to swallow. Can we stop with the gummies? I mean, honestly, like
Mhm.
there's grown-ups walking around wearing pajamas all day, taking Flintstone vitamins still, and then
That's
complaining that
exactly.
things aren't in gummy form. And I'm like, when did you not grow up?
Hmm.
Exactly. And I mean, you just have
Those
to.
are probably not the people looking for magnesium supplementation, but I could be wrong.
Uh, I think people are because, and if you just read the non-medicinal ingredients, because they don't, I don't know how they do it in the States, but here they have like medicinal ingredients at the top, and then underneath is the non-medicinal ingredients. And a lot of people will only look at that medicinal
Yeah.
ingredient section. And fine, it's going to say magnesium and it's going to say glycine and whatever else or whatever form you've got. But all the non-medicinal ingredients are going to also increase or decrease how your
Yes.
body is going to take the medicinal ingredients and work with them. And so when we get into gummies, when we get into liquids, again, they are not going to put out a liquid that tastes gross. No one's going to buy it. No one's going to
Yeah.
take it. So oftentimes we have sugars in there. We have natural flavors in there. We have, stevia and monk fruit and all these other things. And when we're taking magnesium, we want it to be as basic as it can be because we really
Right.
want that to get into the cell. It's already needs to be attached to something in order to get into the cell. And now you're making it a lot more difficult. Now, that's not to say that, if you want to give it to children and they can't swallow pills or you do have somebody that really does not do well with swallowing pills, those options are available, but it's not my first go-to for sure.
Okay, that's helpful. What about you said L-theanate? Is that did I pronounce that right?
Yes.
Is that technically could that fall under the amino acid profile, or is that straight magnesium still? Magnesium
No.
L-theanate.
It's threonic acid and magnesium, right? So
Okay.
it's again they're not all amino acids. Sometimes they're just another nutrient, right? So we know that threonic acid actually is also in the brain. So this is how it's going to cross that blood-brain barrier, right? So
Got it.
they're not always considered amino acids, but it's
Yeah.
another molecule that allows for that magnesium to get where it needs to get to.
You are a wealth of knowledge, Dr. Barb.
Mm.
Really. Um, Paige, can I ask a question
Oh,
about?
yeah, yeah, yeah.
So one of the things that I've noticed that, I dealt with some autoimmune symptoms for a while, and they were leaning towards some very, severe autoimmunity. Um, and sure enough, left the environment that I was in, and that the symptoms got better, much better. But I'm noticing still some of the some of the basic um signs and symptoms that I was dealing with a while ago are there. Nothing major.
Right.
Excuse me, one of the things I'm noticing is restless legs. And I'm noticing, I noticed right around, related to my cycle, it seems to get worse certain times in the cycle and better other times in the cycle. I don't, I dabbled with hormone replacement therapy for a few months, and I took myself off of it. I saw some signs of estrogen dominance and took myself off of it right away. And what I noticed, we were playing with the estrogen levels, and it just was not, it was the estrogen dominant signs were not going away. So I thought, okay, let me table that for now, revisit it maybe in the future. But no, excuse me, the RLS is something that like I said, a few times a month I'll notice. And it's just enough to annoy me a little bit.
When you're
So,
sleeping.
excuse me, or trying to, yes.
Mhm.
What are your thoughts there, Dr. Barb?
Yeah, so restless leg is there's a lot of research behind it, and magnesium is definitely one of the deficiencies that we look at. But the other big deficiency with restless leg is iron. So you have to remember minerals are
Yeah.
always important. And so when we are looking at things like restless leg, that's more of like a neuro issue, right? Like it's not just your leg starts moving on it. It does
That's right.
actually, but it is a neuro issue. So we always want to make sure iron's looked at. And most times restless legs is a deficiency in iron and magnesium together. And so we need to then look at, okay, so what kind of dosing do we need to do? So we need to make sure that iron is where it's supposed to be, and we need to look and make sure that once that iron is there, magnesium is dosed appropriately. So it is a bit of a combination of both of those. Um,
Yes.
but yeah, like that's kind of where that starts. And then once those numbers are kind of where they are, most people find a pretty good benefit from it.
Yeah, I have as well. Now, one of the magnesiums that I took was the thorn magnesium citramate. So it's a
Mhm,
combination of the citrate and the malate.
mhm.
And of course, now it's all marketing, right? With companies like Thorn, of course, but they talk about it, targeting cardiac function, enzyme function, bone density, muscle tenderness, fatigue. I mean, it can the right combination and the right dose, right? Like you said, starting small and working your way up. Can that really have those kinds of benefits?
Yeah, because we have to remember too, like even though it's attached to a molecule, magnesium has its hand in a lot of those 800 enzymatic reactions. And
Functions, yeah.
so it has a wide range. And so this is the problem when, people have random things that go on and then nobody ever looks at, oh, well, maybe we should see if they actually have enough magnesium in their system. But
Beautiful.
there are other ones like vitamin D and calcium that we think of right away. Like we think of bone health and it's like vitamin D and calcium. And we have one problem there because both of those need magnesium. And if you don't
Yes.
have magnesium, you can take all the vitamin D you want and you're not going to be able to absorb it and your body won't be able to work with it. And so we don't think about kind of what is starting the engine to make
Mm,
that car drive, right? And so if we can't start the engine, the car isn't going anywhere. And this is what's happening with a lot of different things in the body. So in general, magnesium can target almost everything in your body
Wow.
because
Mm,
every single cell requires magnesium.
wow.
Every single cell.
it's
And
huge.
the importance. Yeah. Yeah.
Mhm.
Yeah.
I think Jamie asked if there is a brand that you recommend. If you said it, I missed it.
Mm.
So where do you direct people?
When in practice myself, I usually just prescribe. We have a dispensary that we prescribe from that
Oh, I
is
see.
Catholic doctors, and a lot of them. But I would say like if we were looking at commercially brands, I usually tend towards Designs for Health, which I think is still available in the U.S. as well.
It is. It's great.
Thorne, NFH, Cytomatrix, those kinds of things. Those are kind of the brands that I stick with. There's something called New Roots here, which is a fairly good brand. So yeah, Natural Factors can also have it's not, a lot of people are like, oh, because it's cheap. And that's not always the case because certain
Right.
magnesiums are going to be cheaper than others, right? Like I said,
Right.
Mhm.
L-threonate is not inexpensive compared to citrate, for instance, right? Like
Sure.
Mhm.
a lot less for citrate if you rather than the L-threonate. So it's not so much the cost, but you also kind of want to make sure that it's, just that form and it's not mixed with all kinds of other things. Yeah.
Mhm. Beside,
So helpful. Go ahead.
uh, since we work with an audience that are suffering from the effects of ultra processed food, so they're trying to recover from that and get off of processed foods, sugar, flours, those types of things. And so, besides supplements,
Mhm.
is it possible for people that are just trying to look for whole food sources is there enough magnesium in whole food sources that would satisfy the body's
Good
needs?
question.
And that is a really great question. And
Oh, thank you.
I am always food first. Unfortunately, due to our farming practices, due to the
Mm,
soils are turned over, we are not getting the same richness when it comes to
hmm
nutrients and minerals from our soil. That
hmm
being said, you also, if you want to get magnesium from foods, you need to eat primarily plant foods because that's where magnesium is found, right? And so
Yeah,
if we're eating a lot of processed foods, we're not actually getting very much magnesium
makes
from
sense.
Sure.
a food perspective. Now,
Yes.
it's really, you have to be diligent to get to even the RDA, which would be probably for some people up to 400 milligrams per day.
Wow.
So when you think about the magnesium, most magnesium rich food would probably be pumpkin seeds. It has the most amount of magnesium in like a third or half a cup of pumpkin seeds.
Oh,
Uh,
wow.
yeah. So, you have to really be diligent because you also have to remember that what is depleting your magnesium. So, if you're on diuretics, medication wise, if you're on a proton pump inhibitor for GERD or acid reflux, if you're taking antibiotics, if you're taking birth control
Yeah.
pills, if you're taking cancer therapy, these drugs are all going to deplete your magnesium. And then comes the big aspect of metabolic health because 1 out of 3 individuals has insulin resistance. Well, if we're insulin resistant, we're losing that magnesium through the kidneys like crazy. And if we
Wow.
lose sugar, we are also losing magnesium like crazy. There is, and
Wow.
I don't want you to quote me on this, but it's somewhere around this. Every molecule of sugar, it takes approximately 54 molecules of magnesium.
I was going to ask you about what foods or the processed foods, what they do to your magnesium supply. That was going to be my follow-up question. So you can lead into that.
That's fascinating.
Yeah. So processed foods are always going to contain sugars and flours.
Yeah.
So, they're always going to be foods that will drive blood sugar dysregulation, that will drive insulin regulation, dysregulation. And with the sugar, obviously, as I just mentioned, it's eating up your magnesium. So, if you
hmm
are just
Wow.
barely getting enough magnesium from your food, let's say you're actually on it and you've got all this other magnesium being shuttled out of the body by those other things that I've just mentioned, we're not going to have enough magnesium. We can't get it just from food. So we often have to supplement to make up for what you're actually displacing through
Wow.
medications.
Very helpful. Very
Yeah.
helpful reminder.
And
Yeah.
would you say in general, most people are not getting enough, that they would need supplementation?
Yeah, I mean, 60% of the American population is deficient in magnesium. That's just a standard fact. And when we look at that, most of those people are A, not supplementing, or B, not even getting close to getting the recommended dietary allowance amount from food. I think there's a study actually that says most people will get about 200 milligrams, and that's if they're eating plant foods as part of their
hmm
diet. So 200 milligrams is not even the RDA. The RDA is 310 to 420,
hmm
420 being the upper for the males, and then 310 being more female and pregnant women. They go up to around 400. Now that's RDA. And
Yeah.
I don't know if we can even, we use that as a minimum, but the RDA hasn't been changed for magnesium for years, like since the 90s. And
Wow.
we know RDA is based upon weight, the average weight of the individual, male and female.
Mm.
And
Yes.
so our weights have gone up. This is like classic, research that has come out, and yet the numbers have not been
Numbers
changed.
haven't changed.
Yeah.
Wow.
Are there long-term consequences for people that are not getting enough magnesium? Which, if you're saying that's, I think you said 60% of the people are not, what are the long-term ramifications of that?
Well, a lot of those enzymatic reactions aren't happening, right? So if you are
Mm-hmm.
vitamin D deficient. So, it can be health related outcomes that are going to be affected. So, if you have something like an autoimmune disease, I know that was brought up earlier, but, vitamin D is a really crucial vitamin for an autoimmune patient. And if they are deficient in magnesium, that vitamin D isn't actually going to do anything for them because they need to have that magnesium in order to activate it through the liver and the kidneys and get that vitamin D to work in the body. So
Yes.
that's one process that's not working. There's so many more other processes, right? So it can be neurotransmitters. So like serotonin or GABA, these things are not functioning or firing. And we have to go back to the fact that every single cell in the body requires magnesium. So you
Yes.
have a lot of things go wrong with that deficiency. And unfortunately, we are not looking at magnesium because we are just pushing them into those other health issues, those other
Yeah.
health um, outcomes. Yeah.
Well, one of the big questions, I have a family member who I was just visiting with, and she was telling me that she was put on some antidepressants and an antidepressant. And I was thinking about, other levels, like did they check her other levels of other minerals and vitamins in her system in addition to, right? I'm not gonna doubt that the doctor um prescribed something that maybe was the right fit for her from his perspective, but I'm just wondering, like, could there also have been a shortage of magnesium?
It could have been, right? Because we know
Yeah,
that depression,
interesting.
anxiety, bipolar, a lot of those are things that are regulated in the brain.
Yeah,
So the NDMA receptors, which create that excitability of that receptor, which causes depression. We know that magnesium actually calms that receptor, right? So there's lots of research around that. Now, that's not to say some people are still going to need some form of antidepressant or an anti-anxiety
right.
medication.
Yeah.
I mean, it's a case by case, and it depends on that individual as well. But it
Yeah.
definitely doesn't hurt to, trial it and see. But it's not really talked about. And I think that's my biggest passion is to get this information out there and get
I
people
love it.
thinking about things, right? Like
Yes.
we have all this data in this is not, I'm not pulling any of this stuff from like anywhere else but the research. And we
Yeah.
have all this research sitting there. And it's like, it's not, it's old research, some of it's like 10, 15, 20, 25 years old. And then of course
Hmm.
now there's more newer stuff coming out, but we're not doing anything with it. And that's really what my goal is to kind of get that out of there and get people thinking about it. And it was the reason I wrote the book both with Dr. James D. Nicolantonio and the one that I released in May, is because more people need to actually understand what this mineral does and be able to choose the right form, um,
Yeah.
get the best outcomes for their health, like in all aspects of health.
Amazing.
Someone that's listening today, where would they even start with, am I deficient? And if so, what brand do I use? You know what I'm saying? People might be swimming around with all this great information of where would the average bear start?
Yeah, so the average person could start with a maybe incorporating more magnesium rich foods, right? So if they
I
think they
love that.
mentioned. So, if you have some of the more common symptoms of, joint pain and you can't sleep and you have a lot of stress and you have brain fog and, if you're insulin resistant, you are low on magnesium for sure because it's leaving the kidney. But we also
I think
know
completely.
that magnesium is required to sensitize that insulin receptor and work properly. It's one of the major minerals involved in glucose control. So, you know, if there's so many people out there with insulin resistance and blood glucose issues, we know right away that magnesium can help these people. And so starting with implementing more magnesium rich foods, and that was the other thing that I really wanted to do with my book that came out in May, where I talk about the forms of magnesium. The other half of that book, I talk about magnesium rich foods, and I actually put in 40 recipes that were magnesium rich. And I kind of like
Oh.
how much magnesium is in each recipe so that people could understand that if they had this, they were getting X amount of magnesium.
Mhm.
Because food is still in our control and it's something that we can easily implement without any, we don't need to have people around. We can do this on our own.
Yes.
Then I would probably, if you have like a lot of the things that deplete magnesium, then I would probably look at supplementing at least the recommended dietary allowance amount, which is, like I said, the 310 to 420 milligrams. That is where you should be starting minimum.
Mhm.
And I mean, I can't give specific dosages because I can't give medical advice, but I mean, if you start with at least that, and then work with an alternative healthcare practitioner or your doctor, um,
Yes.
you then decide whether or not you actually need more or whether you need to change, how you're dosing it and those kinds of things. But these are just easy things that you can start with today and right now, and that can also make a difference.
What about
This
lifestyle habits? Oh, sorry, Jane.
Oh, this family member that I was talking about, I love her dearly, but she's not into the functional or alternative medical practitioner. So I don't even know if her doctor who prescribed this antidepressant for her would even be how to have that know how to have that conversation really. And I don't know that she's maybe versed enough in it pushing to find a doctor who could. But maybe I'll plant a seed and see what happens.
Oh, nice.
Yeah.
Yeah, so you talked about foods that can improve magnesium. Are there certain lifestyle habits? Because we're big on that in real food recovery lifestyle habits. Are there certain things that people could do, a place to start to work on that might also be beneficial?
Yeah, for sure. Reduce alcohol. Alcohol is a diuretic. It's going to decrease your magnesium stores. A lot of caffeine will do the same thing, right? So lifestyle is more so from let's kind of see what the things are that are going to send the magnesium out of the body, right? So those are kind of two big things. Maybe we look at, not everybody can change their medications, but you know do we need to be on a birth control pill? Can we do something different? These are all discussions that I have with patients every single day when we look at some of the things that we can do from a lifestyle perspective. Obviously, eating whole, unprocessed foods is going to bring more magnesium into your life just from food alone. And so that is definitely another aspect that you can do. And I mean, exercise is always good, but we know that sweating, you're going to lose electrolytes. And so maybe even bringing in a little bit of electrolytes after a workout is also something that you can do to kind of replenish what you've lost.
Yeah, that's
Yeah.
important. Very important. I'm definitely noticing that. In just in, I live in a part of the U.S. that's very, very hot and humid this time of year, and electrolytes are they're critical. But the water just does not always do it. Sometimes you have to sprinkle a little bit of something into your water to get you replenished.
Absolutely. Yeah.
And are you saying that magnesium and vitamin D travel in tandem, so you need to be on a vitamin D supplement if you're taking the magnesium, or have I got that wrong?
No, so they don't travel together, but you need magnesium in order to activate vitamin D in the liver and the kidney, so your body can
Okay.
use it. So a lot of people will say, "Oh, I'm already taking active vitamin D3 because it's activated." And yes, it's an active form of vitamin D, but your body still needs to activate it so that it can use it in the
Yes.
system. And so we need enzymatic reactions that happen in both the liver and the kidney which are magnesium dependent. Okay, so you don't have the magnesium there, that reaction's not happening. So I get this question all the time, do you need to take it at the exact same time? No, you just need to make sure that you have enough magnesium. So if you're one of these people that are on a lot of medications and you have insulin resistance and you drink a ton of coffee and you eat all the sugar and you have processed foods, you don't have enough magnesium in there because there's just no way that that body can actually. So your body is going to start to only do the vital functions and take whatever it can get and use that for the vital functions. And vitamin D is not a vital function at that point. Yeah.
And it's
Yeah.
amazing when you start taking it, it's pretty effective.
It's quite quickly too. It's
Yeah.
not something you
Yes.
have to take for months and months and months to kind of notice the difference. Most people will notice a difference between 1 and 6 days. Like that's kind
Yeah.
of average.
Yeah.
So yeah, it's definitely something.
Now, I've heard to take, like, my doctor had me taking my three doses, but it was three capsules of magnesium in the morning, he said, um, with my first meal. Is that something that you recommend sort of front loading, or do you recommend just spacing it throughout the day if you have to take three
Mm.
doses? What are your thoughts?
I would always space it. Remember, magnesium is needed in every cell, so you kind of don't want to front load everything and then leave the rest of the day. Because now, if you go and work out or you decide you want to have coffee, or
Yeah.
you don't want all that magnesium just spilling out right away. Not that it will in that exact fashion. There's a lot more biochemic chemistry that's
No,
involved.
that makes sense.
But you kind of want to stretch it out. You want to give your body that morning and night dose, or morning, afternoon, night dose. I tend
Yes.
to always kind of dose it throughout the day with
Yes.
patients, and they do best with that.
Thank you. I love that. I'll change that immediately.
Yeah, yeah,
Starting tomorrow.
yeah.
Um, let's see. You want to talk about your top 10 tips for metabolic health and in there, unless Jamie, you have something different?
No, I love it. Let's go there.
Yeah, so obviously metabolic health is something that I do a lot of. And I think it's really important because metabolic health is involved in just so many different facets of our life. And so when I do metabolic health, I'm always looking at making sure they are getting that whole unprocessed food in there, right? So really removing some of those refined carbs, refined sugars. We want to make sure that they're exercising. And as and you don't have to exercise every single day, but at least exercising 2, 3 times a week, 150 minutes for in that week. So it's like 30 minutes 5 times a week, or you can do some longer sessions. And then I'm also looking at stress support, right? So we know that stress is going to deplete magnesium. We know that stress is going to cause blood sugar dysregulation, all of these things. And so this is something that we always make sure that there's some stress support in the management plan. We need to make sure we're sleeping, sleep optimization. This is really, really important. Sleep is when your body does the most work. It does all the repair. We need hydration, water. I mean, so many of us are dehydrated. We don't drink enough. And we're always drinking, the coffee or the black tea. But what we also don't remember or forget is that when we drink that coffee, it is a diuretic. We need to be adding in another glass of water for that. So hydration is really, really important. Incorporating lots of healthy fats to just help with blood sugar regulation. And then, of course, supplements. I always say, some form of omega-3, a vitamin D, a magnesium is kind of my top 3 supplements that I try to get into most people, especially if they're not able to do it through food. And then finally, fiber. So a lot of us, I call fiber like the fourth macronutrient
Right.
because it's just so important, and it makes such a big difference to so many people when they actually
It really
get
does.
enough fiber.
Yeah, it
Mhm.
really does.
No, I agree. Fiber is like king as far as protecting from leaky gut and things like that. So I agree.
Yeah.
Tell us
Jamie,
about
any?
omega-3. Yeah, just real quick question tell us about omega-3 from your perspective. I've heard and I was a vegan for about a little over 4 years. So that was something that I really needed to, I explored different methods for omega-3s, but real quick, tell us your thoughts on omega-3.
Yeah, they're crucial. I mean, they help with the inflammatory pathways. And some people just we don't get enough from food. Like unless you're having salmon and chia seeds and flax seeds on a pretty regular basis, we're not getting enough omega-3. And it also helps with a lot of the brain function that's going on and mood.
Totally.
I mean, it's a full body effect. And Yes, I use it a lot for reducing inflammation, but I also use it for like joint pain and brain health, and DHA for like, supporting even children's brain health and ADHD. These are really important components. So,
Mhm.
and then for the people that don't are more vegetarian, I usually go with the marine one. I mean, we have to
Sure.
dose a little
Yes.
higher, but it's still giving way more than what somebody might be able to get in through food.
Yeah, beautiful. Thank you for the reminder. Dr. Barb, you really were very helpful.
Yeah.
I've can't thank you enough. I think that you've helped people, maybe people who are a little further ahead on the journey of supplements, vitamins, health, healthy lifestyles, maybe put some pieces of the puzzle together that they weren't seeing before. And at least that you've done that for me. I can't thank you enough, really, for your time and your wisdom.
Thank you
Yeah.
so much for having me. I'm always happy to speak about it and try to get that awareness out there.
That's
Really.
exactly what I was going to say. Even for people that are down the road with supplements, for people that maybe aren't that aware, this really helps just increase their knowledge base and not be as scary and just find a place to start to do
Yeah.
something simple and start leaning into it. So great. Thank you so much. We really appreciate your time. And if you want to find out more about us, you can find us at realfoodrecovery4u.com. That's the number 4 and the letter U. And our book is out on Amazon, Real Food Recovery. If food
Okay.
isn't the answer, what's the question? Thanks, guys. Thanks for being here. See you next time. Bye bye.
Okay.
Bye.